Here we have a Tafelmayer retainer, a universal number 1 matrix band, and a number 2 molar band. When the new practical begins, they are going to be testing tooth number 19, which will be a DO. But teeth may change during the examination process, so you need to read the important paperwork from the Committee on Dental Auxiliaries to determine which tooth they may be doing. Because number 19 has a DO, it won't be necessary to use this particular band. You may find in the future, if it is an upper tooth, a maxillary tooth that's being tested, that you may want to use the molar band. They tend to fit a little bit better on the Typodont. We're going to go ahead and show you how to use this universal number 1 band. It has a slight curve to it. The distance from here to there is slightly less than the distance from the outside from here to here. So when we pick up this band and fold it together, this is a little smaller circumference than the underneath side. Take the band so that it smiles, fold it, and place it into the retainer. If you're working on an upper right tooth, this should come out the right. If you're working on an upper left tooth, it should come out the left side of the retainer. If you're working on upper left or lower right, you would turn this over for the lower right side. On 19, of course, we're going to be working on the lower left side, so we're going to have it come out the right this way. We're going to tighten the outer nut all the way down as tight as it'll go. Give a little tug on the band to make sure it's secure, and now we can turn it over and place it on tooth number 19. The matrix band is then simply placed over the tooth, making sure that you fit it over both edges. Center the spindle box in the middle of the tooth, and then rotate the inner nut until the band gets smaller around the tooth. Once it is secure, stop. Don't force it. The band can become too tight and then will not flare out and meet the tooth next. Now it's time to place a wedge. Wedges are triangular in shape, and you want to make sure that the base of the triangle is sitting on the gingival tissue. You can place it with your fingers, or you can use a pair of cotton pliers. Make sure that the matrix band itself is sticking above the cusp height of the tooth a millimeter or so that when you go to trim your filling at a later point, you'll be able to do so and press up against the matrix band itself. After many years of teaching temporary sedative dressing placement for the examination and for the use in the dental office, we find that the following instruments are the best. There may be other things available that you would prefer to use. We have decided that these are the best instruments, and these are the ones that we use to teach with to give us the best result. You have a spatula to mix the cement with, an acorn carver or burnisher to create anatomy, a half Hollenbeck carver, and of course a condenser. We also include a toothbrush in our rental kit so that you can clean off excess particles once you're finished trimming and refining the tooth. A good solid thick mix of IRM is very important as your first step in preparing for placing a temporary sedative dressing. Here I have 2 portions of powder out. I've put a small amount of liquid. I'm going to incorporate almost an entire scoop of powder into the liquid right away. And work the powder back and forth with the spatula. Notice my fingers out onto the end of the spatula so I can get as much pressure on the powder and liquid as possible. Once the material starts to pull apart, similar to pie dough, then you're almost at the correct consistency. I'm going to add just a little bit more powder here. Again, this is not an exact mix because it depends on how much liquid you've actually placed on the pad. At this point now we can gather that up. And I'll roll it into a nice little hot dog shape. Kind of have it. Oh, cut this now into a couple of sections, and that way we can easily pick that up and place it right into the preparation. After the material is properly mixed, I take a small amount of it that's rolled into kind of a little hot dog shape and place it in the preparation. Put a small amount of powder on the end of a condenser so that the material won't stick, and gently condense the material first down into the gingival seat area. You want to get the material quickly into the preparation so that you have enough working time. Just gently tap it into place and try to keep it within the confines of the preparation itself. If you need to add additional material, again, make a little roll, place it in the preparation, place a small amount of powder on the instrument, on your condenser, and condense it into place. As with most filling materials, we generally tend to overfill the preparation at first. Now there are a variety of other instruments you could be using. We happen to use an acorn carver to create some additional anatomy. The acorn carver has looks like a little acorn that you might find on a tree. You place it just about 1 millimeter inside of the distal margin. Press down as hard as you can and pull towards you. That begins to establish basic anatomy. Do that a couple more times. Pull, and then this time we're going to go over into the facial groove. Do it again and go into the lingual groove, and now we've done some basic formation of anatomy here. At this point I'm going to take a half Hollenbeck carver. It has two ends. This end lays flat, this other end is curved, and we're going to take the flat end and lay it as flat as we can and go from this cusp height here to the cusp height on the opposite side and lift off the material. We are establishing a marginal ridge. A marginal ridge is the ridge that goes all the way around the tooth. When this preparation was made, of course, that marginal ridge was cut away, so we're reestablishing it. And this is one of the important reasons why you want your matrix band to stick up above the level of the tooth, so that you can use it to cut against to create that marginal ridge. Might go back at this point and reestablish anatomy in that portion of the tooth. And now we're ready to remove the matrix band. Place your finger on top of the band, undo the outer nut and lift the band off. Take your wedge out with either your fingers or a pair of cotton pliers, and then remove the band from the opposite sides. In this case, we have a DO, and we're going to remove the mesial side first, and then gently pull or lift the band off. If you're going to lift the band up, you probably need to use some sort of instrument, and here we're going to use a very large discoid and support that marginal ridge so that when we take the band out, we won't hurt the marginal ridge. One of the first things you'll notice is that we have some squared off material here, and we always want to have round edges on all of our fillings. So the first thing we're going to do is take an instrument and round that edge on both sides. Don't ever get in the center here where the contact point is, because you won't have a contact point. The next thing we want to do is take the cutting edge of the discoid cleoid and remove any excess material that might be along the edges of the tooth. You lay that on the top of the marginal ridge of the tooth, tip it until the point is in the center, and scrape, and that will remove any excess material that goes up along the edges. that excess material is referred to as flashing. Do the same thing on this side by turning the instrument the opposite direction. Lay it on the marginal ridge, tip it until the point is in the center, and drag. When you're finished completing the restoration, you can use a small toothbrush to clean away any remaining particles, since you don't have access to an air water syringe. At this point in time, you should check your restoration to make sure that it's complete. You want sealed margins, correct occlusal height, a contact point, make sure there's no overhang, and basically you're ready to go.
Here we have a very serviceable temporary filling, and it has contacts, appropriate anatomy, seal margins. And so you might think that this crown would pass the RDA exam and be appropriate for a patient. But there's a little problem, and it tends to be one of the largest reasons why people are recently failing the RDA exam, and it's called open box form. So let's take this tooth out and take a closer look at it. If we take a look at our tooth here, it looks pretty good. We turn it around to the interproximal area, and you look, here's a gap between the filling and the preparation of the tooth. And that's called an open box form, and it is currently one of the most common reasons why people are failing the temporary sedative filling. So make sure that this is either not properly condensed down in there, or sometimes if the mix is kind of sticky, when you take your matrix band off, it will actually lift it off of that gingival seed area. So make sure that you take care of that. It's good after the tooth is taken out of the mouth. It is something that can be seen while the tooth is still in the typodont. So make sure that you take a mirror and look distal of this tooth from both the facial and lingual and check for this kind of thing. You could actually patch this by adding a little bit of material while the tooth is still in the typodont. Problems that might occur with the temporary. So what I've done is gone ahead and broken out the ridge. Let's say that you are nervous, you get a little heavy-handed, and you scrape away and off snaps the ridge. What you want to do is take maybe the discoid and kind of dig that out a little bit. In the exam, as you know, this material sets up very hard, and it's very difficult to remove the entire filling, plus you wouldn't have time to do that in an exam situation. So what you want to do is dig out the little corner that you've had a problem with, and then you can go ahead and put a regular band and retainer back on there, but you don't have to. If you've only got 5 minutes left on the exam, you're not going to want to be futzing around with a regular matrix band and retainer. So you can actually put a band on there, do place a wedge, and hold that in place. We're going to take a little mix here and place it across the ridge. We're going to tap that into place. Just gently tapping here. Go back in with our acorn. Establish a little bit of anatomy there, but not all the way over. We haven't gone all the way over with that yet, because remember, we need to have a marginal ridge. And then do the same thing you did before. Run across here, from one cusp height to the other, and trim that ridge off. Come back in here on this situation and use the acorn just a little bit more. And then I'm going to take my wedge out and hang on to the marginal ridge and gently lift the band out. Okay, now I've been successful in replacing the ridge. I want to make sure it hasn't lifted away, so I'm going to gently kind of press down on it. And then I need to do the same thing I did before. I need to round these edges. Round that side. Run across here a little bit.
Then come in maybe with the acorn one more time to redefine that a little bit if I need to. And come across and flatten this up a little bit. Get rid of any little flashing area. Get my toothbrush, brush it a little bit. And voila, I've replaced the broken ridge in a very short time. I want to talk to you a little bit about the Dremel tool that you're going to be using. It takes a variety of regular-sized dental burrs, so it'll depend on if you're renting your kit, what they've put in their kit for you. They might have lab burrs, they might have discs, mandrels, white composite stones, a variety of things. But most of the renters are using the same type of little Dremel tool. This is a tool that can usually be purchased in a hardware store. So it's a little bit bulkier than a regular handpiece. The important part is that there's a button right here that you press, and then you rotate this collet or collar open and change the burr in that manner. Make sure that you're holding this button down when you rotate this all the way tight, otherwise the burr will not be tight. But one of the problems you'll notice with this is that once you turn it on, and you're holding it in this manner like you would as if you were paring an apple or something and working on your temporary crown, if you happen to get your hand on this, it makes a terrible noise and it actually stops the thing from rotating. So what you want to do is make sure that this button is facing away from you so that you don't do that. The other important thing is don't leave this on and set it on the table, because it's going to vibrate itself right off the table, or perhaps bounce over and hit someone that's next to you, or even injure yourself. So when you lay this down, make sure you turn it off. It has two settings, high and low, and it'll depend on what you're doing and what you're more comfortable as to which setting you'll have it. The off position is in the center. Make sure that you turn that completely off whenever you set it down. One, for safety, and two, to conserve the battery power of the Dremel itself. Let's take a look here at a couple of items that you might consider when you want to finish down your custom crown. Remember now that the crown is a combination of resin and glass. It tends to be a little less forgiving than pure resin and can shatter or break more easily, so we want to be careful with what we choose. Let's take a close look at some of these items now. Let's look closely at these individual burrs. We have a typical resin finishing burr, and this is not a good choice to use on our crown because our crown is, remember, a composite, which is a combination of resin and glass, so that's going to cause the crown to shatter or break. So you want to stay away from this traditional lab type burr. There's new burrs on the market. Notice how much smaller the teeth are on them, and they're called red stripe burrs, and those are specifically designed to use on these new type materials. You have your mandrel with removable discs. You can put various kinds of grits of discs on these, and some people like to use these, and they work nicely if you are familiar with how to make them contour and work. We've seen a lot of students do a lot of damage with them as well, so it certainly takes some significant practice with these before you get really good at them. We have a small diamond in our kit, and we use them in class as well. These are really nice for finishing margins near the gum line, or near the preparation line, I should say, and you'll see me use that in a little while. These are nice as well. It's recently because it does a really, really nice job. I want to take a look at the new mixing guns and new mixing tips. We're very glad that they've changed the design of these tips because they work much better, and you shouldn't have a problem with them on the exam whatsoever. The mixing gun itself has a large and a small plunger, which of course match the large and small openings in the resin cartridge itself. So make sure that you line those up correctly, lock them in, snap down the security lock, and then on the back you'll see a button which you want to press up and push forward. And then once you have that on there, you're ready to go. The next thing you want to do is secure a new mixing tip.
and you simply just turn that and pull downward. You'll find out that you're going to need to pull downward. If you try to pull straight out, it won't come off. Set that aside, or most appropriately put that in a trash bag so you don't confuse it. Line the large and small holes up with the large and small holes here. Slide the tip on and then twist it all the way over and you're ready to go. Then you would simply press on this. You can see the resin coming down into the tube and you're ready to go. Once you enter the examination room, the Committee on Dental Auxiliaries will provide you with the crown prep that you'll be required to fully seat and screw into the typodont. Make sure that the preparation is flush with the rest of the teeth. If the preparation happened to be turned by accident slightly to the medial or distal, this would have a major effect on your ability to correctly prepare a temporary resin crown. Place it. Run your finger gently across it to make sure that it's flush with the tooth on either side of it before you place this. Just for a minute, I want to take a really close look at this preparation. Now, we are not allowed to have the actual preparations that are on the exam, but these are similar to the type that are being used. Remember, this video is being updated in 2003, early 2003. And so it's possible that the tooth number may change. It might be changed to number 9, or it might be going to a posterior crown. But at this point in time, the crown prep is for tooth number 8. It is a supragingival crown prep. And this causes some problems for some people. So I want you to notice that the crown prep and shoulder are right here, and the crown would extend from there. It would not go up into this area. It would not go to the gum line like you would normally see on an anterior crown. And this has caused a number of people to fail the exam because they have made the crown to go all the way up and under the gum line. So notice the shoulder here. You want to make sure that the temporary crown that you make just goes to that shoulder and is flush with the shoulder. It's probably an excellent idea to apply a very light coating of petroleum jelly to the tooth on either side of the preparation, plus a little bit on the prep itself, simply because these teeth are ivory or made of a plastic material, and your resin material for the temporary may adhere to it otherwise. Don't get too carried away and put too much material, too much Vaseline on here. Let's go ahead and load our impression here with resin. Make sure that you make it come all the way up to the margin on the top, but it's not necessary to get real excessive with the amount that you put in there. Okay, that will be good right there. Let's also go ahead and extrude a little bit of material onto the mixing pad. That's going to help us time the removal of our impression from the typodont. The typodont, of course, has no body temperature, so we're going to have to rely on the consistency of the material on the pad to help tell us when to remove the impression from the typodont. About 20 to 30 seconds after you've placed your impression, start touching this material, and once it gets rubbery, just like this, it's no longer, I can cut into it, then it's time to remove the impression from the mouth, and you want to do that right away. All right, we're going to peel the impression back just a tiny bit and take a peek at that. That looks really good at this point. I'm going to check this and make sure that it's reached this rubbery state. It's still a little bit thin, so I'm just going to leave that alone for a minute. Let's check it again. It's gotten to that nice initial rubbery state, so I'm going to take a half Hollenbeck and insert it partway through here and do a downward pull motion and loosen that just a little bit. Do the same thing over here and loosen, and you can see it start to release. There it goes. And then I'm just going to leave it like that as we've got it loosened now. And I don't want to take it all the way off. I'm going to push it back up here. In the meantime, I might go ahead and take off any excess that I think I'm going to be removing later and cut down on the amount of work that I need to do later on. I can go ahead and get rid of some of the stuff up in the embrasure area. Now this is really important. If this has started to set for me at all where it is more brittle, I don't want to do this, and I'm going to have to wait and trim this off the burr later. But if you can get to this while it's still rubbery and soft, you can go ahead and take care of some of the work you might need to do later. One of the reasons that people tend to fail the crown portion of the RDA exam is they cut off their contact points. So what we're going to do to help avoid that is take a pencil and find out where the contacts would be. You can look next to this tooth here and see the contact's right there. The contact is right in this location, so we're just going to take a fine little pencil and draw a nice little line across there. What we're going to do then is avoid going beneath that line when we trim our crown. Okay, let's go for the next part. We're all still going to take our fine little mechanical pencil, and we put these in our kits because they stay really sharp, they're really, really tiny. And we're going to turn the crown sideways here and catch the edge of the flashing or material that goes over the side of the crown and make a little mark there as well. And you can see that we're getting a nice little pencil mark there. Turn it over and do the same thing on the back side. Now the crown will tell you exactly what part is the tooth and what part is the excess amount just by catching that little edge. And then we can look straight at that. I'm going to encourage you to continue to do this as you continue your trimming so that you don't over trim and cut off areas that you shouldn't, but that you don't leave anything there that you should be taking away. So now we're ready to start trimming. We've got our crown nicely marked all the way around, and let's get busy with some burrs and discs. Just trim some of that off, and you want to use a real light touch with this because it cuts very quickly but nice and smooth. And then we're going to stop. Here we have removed a good bulk of material up in here in the brazier area. You can see that I still need to take a little bit off over in here, but I've basically reduced most of the embrasure area here. Now you want to go ahead and put the crown back on often, but do not do that until you've completely cleaned out the embrasure area, because if there is a chunk of material sticking out here that binds when you go to put the crown back on and you force it, you will actually fracture the crown. So that's an important thing. Do check, do put the crown back on frequently, but don't do that until you've cleaned this area. So I would recommend to everyone that this is the first area you trim, is clean out this embrasure space. You notice it did not take me very long. I finished both sides of this, and it took me probably about 30 or 40 seconds with that particular finishing stone. Yeah, now I've gone back with the same stone and touched that up just a tiny little bit. I'm further down now. I've contoured it in a little bit more down in here and a little bit more down here. Now it's starting to look like this tooth over here. We do still have a contact right in there. We have a contact right in there. Basically, we're clean and we're good to go at this point. If you're working at the top of the margin of the crown and you're reducing any excess material, make sure that you work inward, from the outside inward this way, and not down on top. Because if you work on the top to trim this, you're going to cut off your margin. You always want to come from the outside inward when you're trimming. You may even want to use a diamond like I have here. I happen to like diamonds really well, but I usually use them at high speed. On your examination, of course, you're not going to be able to do that. So there may be some renters that will have a variety of low-speed diamonds in their kit as well, which work very nicely. If during the process of trimming your crown you accidentally trim away too much or it has shrunk a little bit, you can always add to these. What you want to do is put the crown back on the tooth, mix a small mix of material, and then put it on something like a half Hollenbeck. Right here, for example, we are shy on our margin, and we're going to go back there and repair that just by placing a little bit of material right up against the margin, scrape away any excess, and then we're going to take a little bit of alcohol on our glove and just kind of tap that, and it'll fill that void spot right in. While it's setting, we can scrape away any excess material from the margin. And we now have a repaired area. And here's our nicely finished crown. We have contact points on either side. It meets the margin of the preparation. It's the correct length, matching the length of the central next to it. We have contoured embrasure spaces on both sides. And basically we're ready to go. Let's take a close look at a couple of crowns that people think are finished, and you'll notice that we have a lot of clumpy stuff up in this area here, and that is material left in the embrasure area. Now ours shows up fairly well because we've used our little pencil marks, and that's why it's real important to use a pencil to mark these crowns when you're first learning. But this would not pass. This is excess material left in the embrasure areas. It's pretty darn good from the facial, but what's going to happen to this person? They're going to fail because they have left resin all over the place. Here's another crown that looks like a really nice crown, but as we turn this a little bit, you're going to see that there is no contact there. So missing contact right in this area would be a reason for failure as well. So someone kind of over trimmed that a little bit. Can we fix that and not have to make a new crown? Yes. Now this is a relatively small area that's missing, so we can actually repair this. If it was a significant amount and there were other things wrong with the crown, you would need to go ahead and make a new one. But we could go ahead and fix this, and let's say that you only have a few minutes left on the exam and you do want to repair this, and this actually would work on a patient as well in the dental office. We're going to remove the crown, make a notation to where the contact should be, which is right here. You could even mark that with a pencil if you want, and then we're going to remove that and place a small amount of material there and put the crown back on. We've picked up a very small amount of material, excess resin. We're going to put a little blob of it there. It's a small amount in the contact area. Place the crown back on the Typodont, and voila, we have a close contact. We're going to let that completely set, and that needs to set for about 5 minutes. If you need to then finish it down just a little bit because you got too much on the excess. This is a good example of a crown that has been severely over-contoured, and this looks more like a triangle than a tooth, so it comes up we're taking out way too much here and here, and actually expose the margin of the preparation on this side as well. So you want to make sure that you do remove all the material from the embrasure space, but that you don't over contour. And I see this commonly done in some classes. Also, we're missing some contact area as well. This is a relatively nice looking crown as well, and certainly would be passable for the exam and functional in a patient's mouth as a temporary. It looks great from the facial, but let's see what happens when we take it off and turn it around. And you can see that there's a huge missing area on the lingual here. Sometimes these crowns are very thin on the lingual because of the preparations that come to use this, and you'll need to learn how to patch that. We're going to show you that while you're attempting to make a temporary crown. If you continually have the lingual go through or be extremely thin and break all the time, then you need to raise your hand and ask the Committee on Dental Auxiliaries for a new preparation. It is how that particular preparation that they've given you is sitting in your particular Typodont, and they should provide you with a new one. If, however, no matter how much you try, you still have this problem, then we're going to show you how to fix this. And what we're going to do is extrude out some excess resin, pick up a little bit of that resin, and add it to the area. And be careful that you don't overdo this. Make it as smooth as you can. Put a little bit of alcohol on your fingertip and kind of pat that. And then let that set up.